do SIBO patients have higher levels of negative emotions? And this is a really important study. Observational study, small, 26 patients, and with SIBO and 24 healthy controls. Participants with SIBO were more likely to experience stress, large effect size, meaning the magnitude of the impact is large, anxiety, large effect size again, and neuroticism, large effect size. Now, again, I want to be a little bit careful given this is an observational study and it's small. So it's not necessarily the highest quality data point. However, I have a bias here because in the clinic, myself and our clinical team are fairly frequently disheartened at the level of stress, anxiety, fear, and neuroticism SIBO patients come in with. This is part of the reason why I feel it is better to do less testing than more. Part of the reason, because it contributes to psychological burden, if you will, and certainly will not help stress, anxiety, and neuroticism. And as we showed you before, the SIBO testing didn't tell you if you would do any better on a diet as one example. So the SIBO testing, even though it is validated and it can successfully discriminate between healthy controls and those with IBS, it may not be necessary to more successfully treat the individual. So if it's not necessary to more successfully treat the individual, and it may contribute to someone going and spending hours reading about all the ills of SIBO, maybe it's not the best idea to order the SIBO breath testing as you're seeing here. And it's probably a little bit bidirectional, meaning those who have had prior trauma, let's say PTSD, as we discussed a moment ago, may be more likely to develop IBS and SIBO. One direction. The other may be that those who have SIBO may have gut to brain connections, as we've also seen in some research, leading them to be more anxious, neurotic, and fearful. And this has been nicely shown to respond to probiotics as one intervention, which meta-analysis data has found can help depression, and separate meta-analysis help anxiety.